Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic, with another exciting presentation on a very, very interesting subject, multiple sclerosis, and also fibromyalgia and other health-related topics. And this is going to be very important because at the end of this, I'm going to be covering some additional very, very important health topics that are involved with not only fibromyalgia patients, but maybe some of you that might be here just listening to what I have to say. Multiple sclerosis is a very, very interesting disease. It's very frustrating. It's an autoimmune disease. It occurs when your immune system actually attacks the body's own nerve cells, and it disrupts the communication between the brain and all the other body parts itself. Now, it's an unpredictable disease of the central nervous system, and there's no known cure at this time. Some treatment is available that can reduce the symptoms of the disease, but there is no reversing of this disease in itself. Treatment often is long-term, but it's important to get started with the treatment as soon as possible as far as diagnosis, and that's the problem, the diagnosis of this, because some of the first symptoms of multiple sclerosis include something called paresthesia, numbness and tingling, maybe some fatigue and weakness, maybe lack of concentration, and all of this is involved with something that's very, very similar to fibromyalgia patients, isn't it? It sounds just like the symptoms of fibromyalgia patients when it first starts. But the thing about it is not everybody goes through this. Some other things are involved. Other symptoms might show up like blurred vision because this disease actually affects the optic nerve itself, and also urinary problems. But again, it varies from person to person. No two people are alike. Doesn't that sound familiar? It sounds just like fibromyalgia. It depends, the symptoms that you have depends upon something called lesions. And these lesions actually are formed in the brain or spinal cord. And you can actually see white spots if you have the expertise in understanding and actually studying this. So it actually affects the brain and spinal cord. Every person that has multiple sclerosis varies differently depending upon, again, these lesions itself. Early signs are similar, as I mentioned, to many other conditions, and that's one thing about multiple sclerosis. And in the books you will read that it actually mimics many other conditions, including fibromyalgia, also ALS, Parkinson's, and a variety of stroke and a variety of other conditions. The problem with multiple sclerosis is that it takes so long oftentimes to diagnose this. And the reason why is because this has a tendency to what's called wax and wane. So you have periods where it's really hot, really uncomfortable, and then all of a sudden it disappears. Again, many fibromyalgia patients I talk to say that it comes on kind of a sneaky way. They'll have good days, bad days, and all of a sudden it'll go back and forth and so forth. But the signs and symptoms are more or less severe for MS patients, just like, again, fibromyalgia. But it differs from one person to another. These episodic things, again, what we call waxing and waning, are, like I say, similar to those that you'll see in many of the fibromyalgia patients. And it may take years before it's diagnosed properly. A misdiagnosis is very, very common. So there are two tests, although there's no really specific tests. These are the ones that are most commonly used. They do a spinal tap of the lumbar spine, and they look for autoimmune bodies that are common in MS patients. They also do an MRI of the brain and the spinal cord, and again, I like to say, they look for lesions in itself. Again, there's no specific cure for MS because the diagnosis oftentimes takes so long. There are medications, so forth, that people take, but the key that I'm trying to bring out here is that the similarities between fibromyalgia, again, and this condition, multiple sclerosis. And I've had patients that have come in that have MS, and as I mentioned, there's no fibromyalgia patient that just has fibromyalgia. they have other conditions. And that's what makes it so difficult, number one, for being diagnosed properly. Two, proper medications or treatment for this. Oftentimes it'll be missed for a long period of time. You'll be treating something else with other medications. In the meantime, this condition gets worse and worse. There are special doctors that specialize in multiple sclerosis, but again, it takes time because the diagnosis evolves over a period of time. They also have something called, I'm trying to remember, evoked potential tests. Now, evoked potential tests are ones in which they place needles on in individuals to see whether or not there's a differentiation or weakness of the muscles in wherever the nerve roots go, shall we say. And so these is very, very important tests, along with those of the blood drawn as far as the spinal tap, and also the MRI test itself. Now, there is one symptom in multiple sclerosis that is different from most other symptoms of other conditions, and it's a condition called Lhermitte's. And Lhermitte's is one in which when a person turns their head side to side, they'll have electrical shocks go down into their arms or legs. And this is not common in many other conditions, but it is common in multiple sclerosis, but it doesn't show up many times right away. It can actually be one of those things that takes time before it actually shows up. The key behind this diagnosis between multiple sclerosis and many other conditions, including fibromyalgia, is just like fibromyalgia. It's called differentiating diagnosis, where you check everything else off the list, and then whatever is left, that's what you have. And so the same thing with fibromyalgia. So you'll have all these other conditions that they'll check for and test for, possibly, and just like fibromyalgia. And if you don't have them, then what is left? Okay, it could be fibromyalgia, could be LS, Parkinson's, but there's specific tests many times for those other conditions itself. So again, am I saying that you have MS because you have these? No. Again, but make sure, ask your doctor if he knows of a doctor that specializes in multiple sclerosis, so that you can help differentiate your symptoms and conditions from that condition itself. And again, many times you may have one of these periods of time where if you do have MS and all of a sudden you have this big flare-up, okay, flares for fibromyalgia patients, it might be MS, it might not be fibromyalgia, but keep in mind, fibromyalgia actually makes all these other conditions worse in itself. So I hope you can understand the differentiation between MS and fibromyalgia. Again, it's not that easy, but if something shows up with the spinal tap or the MRI tests or electrical, hopefully your doctor will go in that direction as far as MS is concerned. Fibromyalgia will not have any positives on those tests in itself. So now we're going to talk about other related topics that I just came across, I think, that are very important. Got about 5 minutes on this. And these are very, very important in that it involves diabetes and hypothyroidism and hydroxychloroquine, our president's famous drug medication. There's two drugs that have been actually called off. They've actually been pulled because of problems. One of them is metformin, very, very common for diabetic patients. But there's 5 versions of metformin from different companies. It was recalled over contamination, and they found an elevated contaminant of an N-nitro acetylmethylene. And what it is it's a cancerous type thing that can actually, if you already have it or you might be susceptible to cancer, it'll actually trigger it in itself. So they are pulling metformin off of 5 different companies. I don't have their names, but you might want to check with your doctor if you have diabetes and you're on metformin. Make sure he knows and you know that your medication is not one of these 5 versions that actually have this level of contamination. Very, very important. A second one is hypothyroidism. Hypothyroid, they're also finding that there's something called NP thyroid medication. And instead of doing the medication for hypothyroidism, they found that it has 115% more of the medication. And actually, it's taking hypothyroid patients and hypothyroid and turning them into hyperthyroid patients itself. And so you'll have weight loss, fatigue, you'll have muscle weakness, a rapid heart rate, chest pains, problems with heat, excess heat. So it's very, very important. Again, if you're taking this drug, NP thyroid, make sure you call your doctor, contact your doctor, because you could be going from hypothyroid to hyperthyroid, and the symptoms will be totally different. And so it's very, very important that you understand that you take care of yourself. Your doctor should know. I mean, they keep track of things like this, especially for patients that are giving medications. But again, the diabetes, metformin, they're pulling 5 off because of the fact that it's contaminated and could be actually causing cancer. And the hypothyroidism, the NP thyroid, I have to look down just to make sure I have the name of it properly. They're pulling that off again because instead of having a proper amount, contains 115% of the level that greater than you should have. And so that can actually turn you from hypo to hyperthyroid. The third part is hydrochloroquine, finally. And again, as I mentioned, there's a lot of side effects on the chloroquine medications itself that are out there. They're really just for malaria patients or last chance patients. But they found in the last testing that they did that supposedly supposed to ward off the COVID-19 does not prevent COVID-19 infections. Does not. So if you're taking it, you're just taking it for no reason at all. You could have side effects from that medication that'll actually make your condition worse, or new conditions that you really don't need or want to have. So that's very, very important that you understand that you do not have to take the hydrochloroquine for COVID-19 to either not getting it, or if you have it to treat it. Doesn't work. They did all the tests on it, and they said no, it's not. Don't waste your time. Don't waste your time, even if whatever it is political you believe in, whatever. Don't waste your time and money on something that's not going to really help you and maybe cause secondary side effects from all the symptoms that has beyond which is COVID-19. I mentioned this about 3 times so far in my talks, and I thought I'd bring it out again. The final word is that it is not a treatment for COVID-19. A lot of states, including Arizona, are having upticks in COVID-19. I mentioned that before, just because of the fact that people that automatically, young ones go out to the bar, they say, well, chances of me getting really sick, it's maybe 2-3% only die. I'm just going to get sick with the flu, no big deal. But there are residual side effects from COVID-19 there that we often don't even know about yet. And it is mutating, constantly mutating, and it's changing. And so you want to make sure that you do what you need to do to stay away from other people, except for family members that you maybe know. Wear masks, believe me. I'm telling you, it's going to make a difference. Stay 6 feet away from people unless they're screaming and hollering at you. Then make sure you back off and stay even further away. We don't have a cure for it yet, so the cure is discipline. Discipline of each individual. I don't care how old you are, how young you are. You could be asymptomatic and a carrier and giving it to people. You don't even know about it, and then a week later you get sick, and all the other people that you were messing around with or enjoying could possibly get sick itself. So make sure you take care of yourself properly. The word discipline, okay? Discipline yourself. This is different. This is something that we don't want to face, but we have to, okay? If we want to get back to a state of a new normalcy, shall we say. Again, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. I will not be giving a presentation next week on Monday. It'll be the week after, but I'll stay in touch with you. I have some things that I am taking care of. I am so tired of being in pain. Karen, hello, Karen. Look up Fibromyalgia Wellness Center. Look up the things that we've been talking about. Look up on YouTube and Facebook. I save each and every one of these. This is number 118 The vast majority of them are just on fibromyalgia, on our treatment protocol, on all the things that we do. One of the easiest, fastest things I can tell you, Karen, is your diet. Stay off of sugar, gluten, trans fatty acids, and dairy. They're all known to be inflammatory to individuals. All of them? No. But if one of them is and you're taking it, you're making your condition worse, okay? Look up what our protocol involves. If you have any questions, you want more information, my email is dcken2000@cs.com. D as in dog, C as in cat, Ken, K-E-N, the number 2000, 2000 at C as in cat, S as in Sam.com. Please give us a buzz, email, and I'll do everything I possibly can to give you information that hopefully will help you through this situation condition. I don't know if you're in pain because of fibromyalgia or maybe other things. And again, every fibro patient has other conditions that make theirs worse, and fibro makes them worse itself. Thank you very, very much. And thanks each and every one of you for joining. And we're here to help you as much as we can. I am helping patients long distance, and so we do some videos and talks on the phone so we can help people. Thank you so very, very much. Have a great week, and I will see you the following week, okay, with another presentation. Thank you. Whoop, took a little bit too much time, maybe 18 minutes, but hopefully it was well worth it. Take care now, everybody. Have a very safe and enjoyable week. See you in 2 weeks. Bye-bye.